Friday rules.
I know, right?
I would have been here. I do. Where? Charleston, Cleveland, Charleston. Yeah. Where about? St. Paul. Okay.
Well, I guess it was different. We're living here, and it was like, why
Yeah,
not?
one down here opens at 2 o'clock. Yeah. You can order starting at 1, but they don't open until 6.
Yeah.
Well, you should see that.
How many times I got
4 or 5.
three times?
Just people, people about it, yeah.
What's done more before?
Yeah, I'm with both. Okay. Yeah. My lease is up in August. I think I'm like
I'm horrible.
it seems like there's like another like place in
Are you from here? Where are you from? Is that where you came from before the sun?
No, I think New Orleans. Oh, yeah, kind of had a long and winding road.
Did you like New Orleans?
Loved it. Yeah. Summers are.
I once I did it for
I've never been.
I was in absolutely sad.
And that's how I only heard it. You didn't hear it.
Oh, it's funny.
Good afternoon. On Wednesday, we announced that effective tomorrow, we are lifting all COVID capacity and distancing restrictions. Following the surprise announcement yesterday on the change of policy by the CDC, and in consultation with our health department and our team of public health officials and medical experts, the state of Maryland will now also be lifting the mask mandate in conjunction with all the other measures. For the time being, and also following CDC guidance, public transportation, healthcare settings, and schools will be the only exception. For anyone who has not yet been vaccinated, masks are still strongly recommended in most situations. However, if you're fully vaccinated, which means 2 weeks have passed since you received your second shot or your 1 dose of Johnson & Johnson, you should feel free to safely resume any activities without wearing a mask, indoors or outdoors. Businesses across the state and other workplaces are obviously free to set their own policies with respect to masking, and we support their ability to do so. There will just no longer be any legal mandate from the state. Those who have not been vaccinated are strongly advised to immediately do so. And the easiest way to be protected from COVID is to get vaccinated right away. And we now have 704 pharmacies and 271 doctors' offices providing vaccines. Our 13 mass vaccination sites remain open and fully operational, with direct scheduling available, as well as no appointment opportunities where you can simply walk up or drive through and immediately get your vaccine. Thanks to the massive vaccine infrastructure that we've built, and with 5.5 million vaccinations that have already been administered, it is now easier than ever to find and to receive a vaccine in Maryland at more than 3,000 different locations. And it is clearer than ever that these vaccines are working. As we've gotten those 5.5 million shots, into the arms of Marylanders, the result has been amazing declines in all of our health metrics all across the board and all across the state. Maryland's case rate per 100,000 has dropped by 68% over the past 4 weeks to its lowest level since last July. Hospitalizations have now dropped below 700 for the first time since last November, and they're all the way down to 680. And today we have reached 1.91%, our second lowest daily positivity rate ever throughout the entire pandemic. It has now been 1 year, 2 months, and 9 days since we first began taking unprecedented actions to bring our entire public health arsenal to bear against this invisible enemy. Together, we summoned every ounce of our strength and every resource at our disposal to defeat this threat. We built field hospitals and expanded our surge capacity by 6,000 beds. We procured millions of gowns, masks, and other PPE, and deployed thousands of contact tracers across the state. We built an entire testing infrastructure from scratch, going from doing just 50 COVID tests per day to now surpassing 10 million tests. As soon as vaccines became available, our team began working around the clock to get shots into the arm of every single eligible Marylander. This effort grew to more than 11,400 people all across the state who have now successfully administered those 5.5 million vaccines into the arms of Marylanders, including 87% of our most vulnerable citizens. Today is the day that so many of us have been waiting for and working toward. We finally do clearly see that light at the end of the tunnel. Our long, hard-fought battle against the worst global pandemic in more than a century is finally nearing an end. As we reflect on the hard work and the many sacrifices that it has taken to finally reach this point, we say thank you to the countless Marylanders who helped us get to this point. Our healthcare heroes, the doctors and nurses who work day in and day out on the front lines, our Maryland National Guard citizen soldiers who distributed meals to kids and built and staffed our testing and vaccination sites. We thank every Marylander who volunteered, gave blood, donated to food banks, and all the businesses that shifted their entire operations overnight to make masks, produce sanitizer, to manufacture face shields. And we thank every single Marylander who has gotten their vaccine. Today we also pray for all those families with an empty chair at the dinner table. And we resolve to never forget any of the 8,716 Marylanders who have been taken from us by this invisible killer. Now, as many of us take off our masks and start to put this pandemic behind us, I ask each and every one of you to please just be kind and respectful of one another. Some people feel comfortable getting back to normal life right away. For others, it may take more time before they feel safe. That's perfectly okay, and we should all respect each other. You are all Maryland strong, and I'm so proud of the people of this great state. From the beginning of this crisis, we Marylanders truly have been all in this together. With that, I'd be happy to take some questions. Yes, state of emergency still remains in place. There are a number of things that we eased with the state of emergency that we want to continue. For example, the restaurants and bars and distilleries who can deliver liquor and a number of things. There's no more restrictions in place, but there are some easing of restrictions to help businesses recover and to help people come out of the pandemic. And it also enables us to continue to utilize the National Guard as we as we are continuing the vaccination effort. And so it still remains in place, but there are no more restrictions.
Several governors have said they were surprised by this announcement, including you. That's how you started today. You clearly were not expecting this from the CDC.
It was welcome news. I mean, it was almost the complete opposite of all the messaging that they had been doing up until the day before. And, you know, our team was being cautious. We had already decided to lift the mask mandate as of, you know, we said we were going to do it by Memorial Day weekend, which is coming up fast approaching, and we're just speeding it up a little faster now, thanks to the actions by the CDC. Anybody else? I mean, it's just, the whole thing is silly. I mean, the state's attorney never reached out to anyone in our office about any meeting. She shouldn't even bother to reach out to us because I have no interest in meeting with her while she's under federal investigation. And I would suggest that she ought to focus on scheduling prosecutions rather than, you know, political stunts.
Governor, is there any sort of an update on reinstating the work search requirement for unemployment?
We did that on Wednesday. Yep, I think it's very important. We want to make sure that you know, the people that still need benefits are getting the benefits that they need, but we want to make sure that we're hearing over and over again about businesses not able to staff up because people won't come back to work.
Any thoughts about ending the $300 a week supplement?
We're giving consideration to that. It's certainly something that's under review.
Delegate Resnick today sent a letter to the Attorney General and the State Prosecutor requesting investigations into the pandemic deal. Do you make comment on that?
I mean, it's just absurd. It's, you know, Delegate Resnick and a few of his partisan colleagues have been lying about this effort for 14 months. There was absolutely nothing wrong with the procurement. It was an emergency procurement we desperately needed. It was unanimously approved by the Board of Public Works. The legislature already reviewed it for the entire legislative session, spent a fortune doing with outside, you know, investigators and lawyers, and there's absolutely nothing wrong with it. The procurement was great. Every single one of those 500,000 tests was utilized. Not a single false reading. All of the stories are false. We've repeatedly given everybody the facts, and it's just partisan nonsense. This was, I would say, our biggest and greatest accomplishment during the entire fight on COVID-19. And I know there are people for partisan reasons that want to try to undermine that and lie about it, but it's crazy. It's just nonsense. And this is just the latest stunt.
Could you give us an update about state vaccine orders, how those are, what they're going to be next week, and just how that's going?
You know, we're continuing to now receive an adequate supply of vaccines. We're providing those. You know, we have more than we need at not only all of our mass vac sites and all of our local health departments, but, you know, in all of our doctors' offices and the pharmacies. We have an abundant supply. And what we really need right now are more people to, you know, who are willing to roll up their sleeves and get the shot. But there's no supply problem at all. It's just trying to get those remaining few people who are willing to get the vaccine and just haven't done it yet.
You said the other day that we were going to reach this stage when we hit 70%. We're not there yet, obviously. When will we hit 70% based on the numbers that you're looking at?
We still anticipate hitting it, as we said on Wednesday, prior to, you know, Memorial Day weekend. And we're inching up every day. It's you know, I think we go up about 0.5% or so every day, depending on if that continues. And we're at 66 or 67%.
Governor, I spoke with some health departments today who are a little concerned still about whether they should lift this or not, or follow what the state is doing. They said there's really no way for them to tell who is vaccinated and who
Right.
is not vaccinated. Were you concerned about that as well with this announcement?
Well, so the CDC gave guidance, which was very similar to our guidance. They're recommending if you're not vaccinated, that you should probably continue to wear a mask because it's the only way to keep you safe. If you have been vaccinated, you have no reason to wear a mask because you're already safe. We have to actually operationalize that at the state level. You know, that's just giving guidance, but we can't there's no way to put that into some kind of an order to say, how are we going to ever find out who is and who isn't? We don't know, nobody's checking vaccine IDs. So we decided to continue to give the guidance, lift the order. We couldn't order people that are vaccinated or unvaccinated. It's just a logistical nightmare. And it's a lot of governors complaining to the CDC about that they gave us this guidance, but which we couldn't possibly, implement. And it was much easier just to lift it all and to continue to give people good advice. Yes.
Some other governors and other authorities in other states are kind of looking at some kind of off-the-wall ideas to try to get people interested in getting vaccinated. The governor of Ohio obviously made a lot of news with a full scholarships in our state and a lottery. Are there any kind of new initiatives you're considering to try to get more people?
We're talking about those kinds of things every day, both in the what can the state government do, and also what can private sector companies do to encourage their employees or their customers. It's not quite as good as some of that, but there was a pretty cool thing we did with Lido Pizza yesterday. I mean, I heard people saying, I wish I had waited to get my vaccine because I could have got the free pizza. But I think we're going to continue to do whatever we can, whatever it takes. The vast majority of people, close to 2/3 of all the people in the state, have already just willingly got the vaccine because they believe it's going to save their lives and help their neighbors and keep their families safe. The other people, whatever it takes to convince them, we're going to try to be as creative as we can.
Last question. Do you have a timeline for winding down the mass vaccination sites? I know you talked about that before.
Yeah.
Now that we're here,
Yeah.
a little closer?
We're starting to wind them down already in that we're shortening the hours and we're going to shorten the number of days. We don't yet want to close them because we're still seeing thousands of people every day, and we want to continue to do thousands of people every day. But we have a detailed plan to kind of gradually wind them down. I believe the goal is to probably get rid of most of them by the end of the month. We may have a couple of our highest performers continue to stay open, because as long as they're serving a purpose, we'll keep them open, even if they're at greatly reduced numbers. But we don't need to keep 13 of them open. We don't want to keep 1,500 National Guard soldiers away from their families that they can go home. And now that we have the 3,000 locations, and a huge number of people they're just going to their local pharmacy or their doctor, their usefulness is winding down. And I said when we stood them up, I said my goal is to put ourselves out of business, and we're getting close to being out of business. Thank you.